Everyone. This is Dr. Mary with 4 Points Family Chiropractic. I am coming to you from Austin, Texas, and our office is located in Northwest Austin, Texas, off of 620 and 2222. And what I'm going to be talking to you about today is migraines. So they affect a lot of people, sadly. There's something about migraines that we see in our patients that kind of breaks our hearts. It's almost like a secondary concern for a lot of people. They'll come in talking about low back pain, they talk about neck pain, and then almost as an aside, they're like, oh yeah, and I get terrible migraines. That's awful. It's really terrible that that's how people feel, that they're kind of an aside. But what we find is that migraines, kind of the rhetoric around them is you're stuck with them and you just have to deal with them. And I think that's a lot of the ways that people think about migraines when they're talking about them. But the good news is there is plenty that we can do to prevent them and also help when we have them. So I'm going to give you some tips and tricks today that you can use to do that. Excuse me while I look at all my notes. I have a lot to say and I don't want to lose track. But basically migraines are abnormal brain chemistry, and that's something to keep in mind, is that there's a chemical and a physical thing that happens, and it affects your central nervous system, which is your brain and your spinal cord. So right away you can see why chiropractors pay very close attention to this, right? Like that's what we deal with all day, every day. When we talk about a migraine, it's really frustrating. It's a frustrating condition. I mean, of course it is for the person who's suffering, right? It's terrible pain, it hurts, it impacts your day. For some people it lasts several days. You have to go lay in a cold, dark room. That's not always doable. But frankly, it can be frustrating for practitioners too. A lot of doctors have a hard time with migraines, diagnosing them and treating them, because migraines it's not a diagnosis that fits in a box. It's more like a cloud. It's kind of amorphous. Catching them is hard. They get misdiagnosed a lot before they finally get diagnosed correctly as migraines. So typically they're one-sided, kind of throbbing, pulsating pain, but not always. They will often present with nausea and vomiting, but not always. They can cause light sensitivity, sound sensitivity, but not always. And then they can wake you up from your sleep, but again, not always. For some people, sleep is very helpful. So you can see how you really have to amalgamate a lot of symptoms to see if you even have a migraine. So it's one of those things that we kind of track with patients, but if you've been diagnosed, you already know. They present differently in different populations. It's 3 times more common in women than in men. Kids typically don't have like the migraine symptoms. They have what's called abdominal migraines. So they'll often complain of stomach issues, stomach pain, and that can get misdiagnosed for GI issues, because the little kid's not going to be able to tell you that it's coming with certain other symptoms. It is, though, if your kid is getting card sick a lot, that is often linked to abdominal migraines, just so you know. Some patients have optic migraines or ocular migraines where there's no pain, you just have like one visual field kind of go, or you have like a pinpoint visual field, and those can be alarming in a different way, right? If you're trying to drive a car or do something with fine motor skills and you don't have half of your vision, that can become really alarming really quickly. Some migraines present with one whole side of your body going numb and losing muscle strength. That mimics a stroke. That's a terrifying thing also. So it's all these things that you have to kind of rule out before you get to migraine. But they, again, like I said, are often misdiagnosed. People with, fun fact, people with IBS are 60% more likely to have a migraine. So if you do suffer from any sort of abdominal issues, make sure you're getting checked for migraines also. As I said, it affects women much more than men. But the statistic to me about migraines that stuck out the most is that it is the leading cause of days lost at work for disability and people under the age of 50. So not only is it kind of costing us our comfort, it's also costing us time and money generally. So I'm one of the millions of people that get migraines. I care a lot about stopping them and preventing them before they happen, and then once you have them, kind of dealing with them. They're awful. I know they are. So any tips and tricks I can give you, if you have any questions, make sure you kind of drop them in the comments, and I or one of the other doctors will get back to you. But I think it's important first to know what really causes a migraine. So historically, we've kind of thought that they are vascular, that there's brain, there's pressure on the blood vessels in your brain, and that something causes them to dilate, to open up. It's called vasodilation. And when that happens, the really fragile brain tissue around the blood vessels gets compressed, and that causes the pain. Well, in more recent years, with better research, they found that's actually not the case. Vasodilation is a part of having a migraine, but it's more of an effect, symptom than an effect. So it's kind of secondary to something else. What that something else is has to do with the brain itself. So here's what kind of blew my mind, I think might blow your mind. People with migraines actually have different brains than people who don't have migraines. I know that sounds cool, but it's actually kind of annoying, because what's different about our brains is that they're hyperexcitable. We have high maintenance brains. Basically, they need a lot. They insist, they're needy, they insist on having a stable environment at all times. Change is not good for us. They are just really reactive to our environment. So for example, a brain of a person who doesn't get migraines, they could have a night of poor sleep, or have a glass of red wine, or maybe be around somebody with strong perfume, and they wouldn't really react. It would be annoying. They might be a little bit foggy and tired that day, maybe a little slower on the uptake, but it's not really going to do anything. For somebody with a migraine, any of those triggers can set off a migraine. And what basically happens, it's a inflammatory response. Our brain freaks out, and our brain feels attacked. There's, well, we're really mildly inconvenienced, I feel like sometimes when I get mine, and it creates a cascade effect in our brain. So our cerebral cortex, this big part, the part that controls your, basically all your thought processes, your neurological intake from the world, how it processes that, it starts to get super excited. And what happens is there's a lot of firing in your neurons that happens very, very quickly and very fast and very dramatically. Now, for patients that get auras, this is what's happening. It's the overexcitability of your brain. And for people with auras, the way it'll present is like maybe you'll get kind of a glow around your visual field. Some people hear ringing in the ears. Sometimes it's nausea. Different auras present different ways. But that overexcitability, for some people, it lets them know, oh, a migraine's coming. I need to do something about it. A lot of us don't get auras. We just get the migraine. The migraine itself is that overexcitability in the brain can only sustain it for a certain amount of time. And then there's a rebound effect. It depresses, everything drops back down, and that's where the pain comes from. That's the actual migraine. So what that's called is a cortical spreading depression. It's called CSD. That CSD, for people who have migraines, brains that get migraines, our threshold for that is a lot lower. It doesn't take very much to make our brains really excited and then really depressed. And I'm not talking about depression like you're sad, although that often does come after a migraine. I mean that just your whole nervous system kind of powers down. And I mean, we feel fatigue. We feel like we need to go lay in a dark room. Part of that's pain. Part of that's we just can't process our environment anymore. And that's what's happening in your brain. So that's neurology behind it. What does that come from? A bunch of different things. It can be genetics. It can be your environment. Again, more often in women than in men. So your born gender can have something to do with it. Trauma's a big part of it. I know when you look at my x-ray from the side, and patients in our office will kind of know what we're talking about, but there's a curve in your neck and your skull should sit on your neck in a certain way. My head is kind of on crooked, and that's part of where my migraines come from. And it's a trauma from my childhood. When I was about 6 or 7, I was running in the street. I tripped, I fell, I hit my head on the curb, and my chin on the curb like that. And once I was assessed that I didn't need any stitches, nobody checked me for anything else, but it wedged my head in a certain way, and now decades later I'm dealing with migraines. So that's one of those things that we really check for, and traumas like that create an overexcitability in the brain. And what that's basically doing is activating your sympathetic nervous system. You will hear the doctors in our office talk about this a lot. It's your fight or flight. The way you control that part of your brain is by affecting where I was just talking about, here at the atlanto-occipital joint, where our brain stem goes down into our body. So it's the circuit breaker between our brain and our body. And a problem there can have a huge trickle-down effect, both down and up. So for our patients with migraines, we always check this. So if you have migraines and you haven't told your doctor, please tell us. We check it anyway, but we'll do a more in-depth check there. If you know somebody who has migraines who thinks that they should get checked out, give our office a call. Our exam is a full history with the doctor. It's any necessary neurological and orthopedic tests. We do full spine x-rays if necessary, and we follow it up with review findings with the doctor. And if you want to get somebody checked out and they call and they mention this Facebook Live, or they say the word CSD, the term CSD, they can get that entire exam and a cervical orthopedic pillow. It's usually $348 in our office, but if they mention this Facebook Live, they can get it for $97, the full exam and the review findings and the pillow. Just give us a call at 512-345-9355. Now, ultimately, the problem is your threshold, right? You need to know it. You need to know what your triggers are. So here's my first trick. Know what those are. It's easier said than done. It's a little bit tough to know what your triggers are all the time, because sometimes what happens is you reach almost a critical mass. So things you didn't think were really triggers, turns out they are. The most common ones are things like dehydration, weather change, red wine is a big one, chocolate, sleep, too much or too little can go either way, which is frustrating also. Hunger, low blood sugar, any sort of alcohol, smoke, stress, hormone changes. For 50 to 80% of people with migraines, stress is the biggest trigger. But once you know those, you have to make sure that they don't all stack up on each other. So maybe you can have A and B and you're fine. You're stressed at work and you have a glass of red wine that evening, you're totally okay. But if you have A, B, and C, that's when you're in trouble. So say you're stressed and you go with your coworkers and you have a glass of red wine and the bar is smoky and somebody next to you has just drenched themselves in cologne. You're in trouble. That's when the migraine happens. And it's because these triggers have stacked on each other and they've sent you into that CSD. Your brain excitability just happens, it gets depressed, then comes the migraine, and who knows how long it'll last. So what you have to do when you're looking for your migraines is you have to log them. I know this is laborious, it is boring, but I promise you it's going to give you information that's helpful. When you have a migraine, either have a notebook, keep a note in your phone. You're going to want to record when they happen, how intense they are, and how long they last, any symptoms that go along with them. And then you're going to want to think back over the day before, the past few days before, what was unusual that you did in your life that you think might be related. Like, I can have a totally normal day and be stressed and be clenching my jaw and then smell gasoline, gas my car up, and that might trigger one. So if you kind of know what you're looking for, what a normal day is and what your triggers are, you can kind of trace back and see what's actually causing them. The second trick is to make sure you're supplementing appropriately. Obviously, overall good nutrition is a big factor here. Dehydration is one of the biggest causes of migraine. It's one of the biggest triggers. I've known patients who have completely eradicated them because they started drinking enough water. You have to make sure you're drinking enough water. But beyond a regular, good, healthy, balanced diet, again, the way our brains work is a little bit different. The biggest thing that you want to supplement is magnesium. People with migraines have been found to have lower levels of magnesium in their blood. What magnesium does is it helps control your serotonin levels. When you have a migraine, your serotonin, that neurotransmitter in your cell that helps kind of control and mitigate pain, it goes up and then it crashes. So that's another reason we'll kind of feel like sad and like lethargic coming out of a migraine, is because our serotonin levels have just tanked. One of the minerals that helps us mitigate that, and the serotonin generally in our body, is magnesium. I recommend about 400 milligrams a day for people that do suffer from migraines. Take it with a meal. It'll help any sort of digestive distress that you might get, because sometimes it'll upset your tummy a little bit. B2, riboflavin, that's another thing that you can consider supplementing. It works the same way as the magnesium. People with migraines have also been shown to have lower levels of that. And then coenzyme Q10 also helps with migraines. There's a great study out there. People with migraines who had 3 doses a day of 100 milligrams of CoQ10 had about a 50% reduction of migraines. So it could be worth just taking a look at your supplementation, changing that, tracking it in your new tracker that you're going to have because you watch this, and seeing how your body did with that. So if all this has failed you and you have still had a migraine, I get it. It happens. So much of what triggers you is not in your control, and it's just something that happens to you along the way. But having good strategies to mitigate that when it does happen makes a big difference, because migraines can last for days, weeks for some people. So whatever you can do to nip it in the bud before it becomes a problem too big, or handle it when it's happening, that's going to be helpful to know. So remember that even though a vascular component is not the main reason that the migraine is happening, once the vasodilation happens, there is vascular pressure on the brain. So trying to help that as much as you can is really helpful. People kind of already instinctually know this. You want to go lay in a cool, dark room to take the stimulus off your nervous system. So we're mammals that way, right? We're wounded, we want to go into the cave. But if you take an ice pack cold, that's going to vasoconstrict your blood vessels that are dilated, and you're just going to want to put it wherever you really feel the migraine. Whenever mine start, they begin at that subluxation that I was telling you about earlier, and then they work their way forward, and they sit right here behind my left eye. And I'll get those kind of flashes of light, but my instinct and what usually helps is to put the ice like directly on my eye there, which isn't always comfortable in the eyeball, but it really, really helps take down any sort of swelling inflammation that's happening in the blood vessels behind the eye. And I know that's what's happening because the visual changes happen. So if you kind of know where ice helps, put the ice there, make sure you keep it cold. You're also going to want to consider trying caffeine. Caffeine's tricky. For some people it's a trigger, but for a lot of people it does that initial constriction. It ends up dilating later, but keep the dosage small, like less than a full cup, just a few sips of caffeine, see if it makes a difference. If it does, you kind of have that in your arsenal as something that you can consider using when you do have migraines. Make sure, again, you hydrate, lots of water, lots of electrolytes. I'm not a huge fan of the sugary drinks like Gatorade and Powerade. Most of us aren't expending that many electrolytes to really justify having that much sugar, but they have good powders that you can get that are mostly just the potassium and sodium. There's a lot of them now. I've been seeing them all over the place. Consider having some of those in your work bag, your purse, your backpack, just so you can add them to water if you feel one starting to come on. I know it's going to sound weird that I say people with auras are lucky, but you get a little bit of a preview of what's coming, so you can kind of catch things before they become full-blown migraines. I don't get those. Once it happens, and I'm just stuck with it, and I'm begging one of the other doctors to check me. But the way an aura works, you have anywhere from 20 minutes to about an hour to kind of get something into you. If it's hunger, eat. If you know that's a trigger for you, try to get calories in. You don't want to do too much sugar. That's going to spike your blood sugar and create a whole different issue. Make sure it's protein and good carbohydrates, kind of the slow release ones, low glycemic index. And then you're going to want to try to get magnesium into you. The fastest way is intravenously. You've been seeing probably more like IV drip places showing up. A lot of them do have migraine drips, and that's magnesium, like straight to your bloodstream, straight into your brain. If you have the time and the inclination to get to one, you can give that a try. Most of us don't have that much time, but it's something to kind of have in the back of your head and know about. And of course, if you're having a migraine, get yourself checked out by your chiropractor. Whenever I have one, it is always a problem at the atlanto-occipital joint, and that every time I get adjusted, it might not nip it in the bud right away, but I know that it does not last as long as it could because I've had them and not gotten adjusted, and that was a mistake. So again, if you are getting migraines or you need to have somebody that you care about get assessed for them, give our office a call at 512-345-9355. We are happy to check anybody out. We do a full consult with a doctor, medical history, any necessary neuro and ortho exams, and full spine x-ray so we can check and make sure there's nothing happening at that joint that's causing the migraines. You can get all of that and an orthopedic pillow to support your cervical spine when you sleep. It's normally $348, but it's $97 if you call in and you mention this Facebook Live or CSD. So I hope y'all got something out of this. Again, the migraines are, I feel you on them, they're terrible. But if you have any questions, want any more details, you can speak to me, one of the other doctors, or drop a comment here below and we will answer it. But thank you for joining me today for our Facebook Live on migraines.